Okay, so you have carpal tunnel, so I'm going to give you an exercise for grip strengthening. So I want you to go ahead and hold this towel in your hand just like this, and then I want you to gently squeeze it. So then I'll just have you do that. Good. And then do you feel any pain with that at all? No. Okay, good. And when you do this at home, I want you to make sure that you're not having any pain during this, because we don't want to make those symptoms worse. So you should be able to feel your muscles contracting in your forearm, and then so it's going to be strengthening those muscles and strengthening the muscles in your hand, and then it will also help decrease your pain. And also by doing this exercise, it's going to make you have more function in your activities that you do throughout your day. Okay. And then I want you to do this exercise 10 to 12 reps of them, 2 to 3 times a day, and about 5 to 7 times a week. Okay. Does that sound okay?
Yes.
All right, good. And then after this exercise, you might have just like a little bit of soreness in your wrist and hand area, which is totally normal. It just shouldn't last more than about a day or so. So you should just be looking for that. All right. Do you have any questions at all?
No.
All right, good. So then you can just set this up at home. And to progress from this, once we get a little farther, we can progress to this ball and just keep on increasing that strength in your hand.
All right.
Good.
Okay, so the next exercise, what we are going to do for your carpal tunnel symptoms is we're going to do what are called scapular retraction exercises. So I'm going to stand behind you. What we're going to do is we're going to pretend like there's a $100 bill in between your shoulder blades, and you're going to squeeze those together because you don't want to lose it, and then you're just going to release and do that again. So go ahead and squeeze. Good job. And release. And again. How does that feel?
Good.
Okay, so you should be feeling a nice contraction in the back of your shoulders. I want you to do those at least 20 reps for every set that you do, and at least 3 times a day, and you can do these every day of the week. They're also very easy exercise to do while you're at work, or if you're sitting on a couch, so you can do more than 3 sets per day. What we're going to be working on is your posture and the endurance of the shoulder muscles. And by improving your posture, the hope is that we will take some of the stress placed on the nerve that's causing your carpal tunnel syndrome symptoms. Do you have any questions?
No, sounds good.
Okay.
Thanks.
Okay, so the next exercise that we're going to work on is called a nerve slide. So nerves like space, movement, and blood, and this exercise is going to help with some mobility, which in turn will help with the space and the blood as well. I'm going to show you how to do it, and then I'll assist you through the movement. It's very specific, so we'll do it slowly. So I want you to start with your hand up next to your body like this, and then I'm going to slowly have you extend your arm out with your palm facing away, just until you get to that point of pressure, and then I'm going to have you come back off of it so that we don't have that pull sensation. And then from there, once you get to there, I'm going to have you tip your fingers and your head in the same direction, back and forth. We'll do that 10 times, 3 times throughout the day. So I'll have you lift your hand up next to you, perfect. And now slowly let's extend out, and just when you feel that pull, I want you to, yep, perfect, stop and come back. And now I'm going to have you tip. Perfect. How's that feeling?
Pretty good.
Okay. Like I said, 10 times, a couple times throughout the day. If at any point you feel that pull, I want you to come back towards the starting position.
Okay.
And if you have pain with this, I want you to stop doing it.
Okay.
Any questions?
No.